for targeted populations, partners that serve them. We have some supplemental requests. We've kind of started with folks who have a supplemental request. And commissioners, do you have anyone in particular you'd like to start with? Oh, Jill, thank you.
Commissioners, I think you've got the list of the agencies that are here for this conversation today. And I also wanted to note, I know Bob brought up the local voucher program proposal. I can speak to that. But you've got proposals here from the supplemental request from O'Connell Children's Shelter, Senior Resource Center, STA Care Center, Willow Domestic Violence. There's some themes in these that we've talked about previously, and some of the other requests related to cost of living expenses that you'll see here. But I also just wanted to highlight that we've been working with agencies that are on this list and also that are at the table here, but also that are in the room today that we've been working with over the last year and years previous to transition to our new service agreement model, where we are requesting reimbursement rather than front-loading organizations and asking them to report their outcomes. And it's been a transition, and that's been a lot for some of our organizations, but all of them have really responded really remarkably. And I'd say from an admin team perspective, we have tried to be flexible and supportive as we develop the outcomes reporting that we get each month or each quarter. And I just want to make sure that I'm acknowledging that the work that some of these organizations have done to work towards that transition, which has been a shift. And I would guess that you'll see more organizations move to that in the next year after we approve this year's budget. But with that, I'll pass it back to commissioners to identify any of the organizations that are here with us with the supplementals or that may be in the audience that can answer any questions.
If we can start with the partners we have at the table and just give us your name and organization, that'd be super.
Hi, I'm Jessica Beeson. I'm with the Willow Domestic Violence Center. Sorry, I went to the courthouse.
Megan Poindexter, the Senior Resource Center.
Gina Meyer-Hummel and Erin Harmon from O'Connell Children's Shelter.
Jennifer Ananda with the Sexual Trauma and Abuse Care Center.
Thank you. Commissioners, do you have a particular place you'd like to start with our supplementals? Me. So O'Connell Children's Shelter, you have 2 additional prevention programs, case managers. Can you talk about the gap that work would fill?
So currently, one of the situations that we've seen in the last year is the significant continued rise of high school truancy, as well as truancy across middle school and elementary school. Our staff has been meeting, especially with the school district, with USD 497 specifically for the last year plus. And we've made a lot of great strides in that and really been looking at what the needs are. The concern is too that positive news, I guess I should say, we created an MOU among the school district, the district attorney's office, the children's shelter, Center for Supported Community, or sorry, Kelsey, she's gonna kill me for that, but for the support ed program, and then and DCF. So with that, what we did was we backed up truancy even more to a more pre-truancy type level, where the second that they are deemed as legally truant, then we can get in there and get services, and we can all talk openly with that MOU. We saw a very significant rise with that. We knew that was going to happen because we're getting to them sooner, which is wonderful. But the issues then become, how do we serve all those kids? Where do we put them? Who, and so we've just outgrown what we have had over the years. And right now we only have 1 truancy case manager. And I did the numbers this morning, and we have 72 kids on our high school truancy program. And we expect that to continue to rise. We've seen an increase with Eudora School District throwing in kids and that kind of stuff. And I do believe with Dr. Bill DeWitt becoming the principal out there. He's a huge supporter of O'Connell and the truancy program, so I anticipate that to increase as well. Referrals from Eudora. I also had a conversation with the district attorney's office this morning, and we traditionally haven't done as much with the Lawrence Virtual School, but that is changing as well. They are developing an attendance policy and things like that, so that will rise. And so I know, and Kelsey can speak to support ed, but I do know that, you know, we just have an excessive amount of kids, and we're trying to balance between the two agencies and how we can serve as many families as we possibly can.
You mentioned a waiting list. I don't know if Kelsey's online. Is she? Yeah. I didn't see anything in their budget information about a waiting list, so I just wanted to confirm that between the two agencies.
Commissioner, I can answer that up until just now, we've never had a waiting list. So this is the first time O'Connell Children's Shelter will have a waiting list. But if this isn't funded, this would be the first time we would have to institute a waiting list for the numbers that we're currently going to be serving. So
Okay.
And is that due to moving from more post-truancy to a pre-truancy? That's where that caseload number is increasing?
and then I think in addition to that, Commissioner, it's also the 8th graders going into 9th grade. There's some kind of carryover there where we're also serving that population. So in addition to what Aaron's already spoke to, we have some additional young people that we're serving kind of at that 8th, 9th grade level as well. So yes, correct.
I just want to clarify, I think that using the word waiting list is it's really a monitoring list. We're still having conversations with parents, with kids, with students, and they're just not assigned a mentor. So we're still following those families, and we're still offering services. We're still making referrals for services locally for those families. So I want to be careful about using the word waiting list, because we're still serving them and we're still monitoring them so that we can try and help them as much as possible in that transition period as we wait for a mentor to be assigned. I don't know if Kelsey has anything she wants to add.
Yes, can everyone hear me? Sorry, I just had to switch over to a different sort of Zoom platform as a panelist. So I want to make sure that everyone can hear me.
We can hear you. Yep.
Awesome. Okay. So yes, we have gotten an influx of referrals at the elementary and middle school level. Just like Aaron said, there's a lot of kids who are experiencing truancy related challenges, and we did receive a lot of referrals. We worked with about 70 kids, I want to say, this year, and we hope to continue working with more kids. But yeah, so we had to kind of revise our model a little bit so that, like Pam said, the kids, we wanted to serve everyone. So rather than giving a mentor to everyone, we kind of are in the process of creating a tiered system of support using some data analyses that we've created. We're kind of piloting that out. But the only difference when we say wait list, it's just that they don't have a mentor. So they are receiving case management, they're receiving community resources and services. We are monitoring their attendance, we are checking in with them, we are reaching out to their parents and schools. The only thing we're not doing is they do not have a mentor who is implementing our individualized behavioral interventions that target some of those underlying issues related to truancy.
Thank you for that. So getting at kind of the nature of the work, like what happens within that case management specifically, and what happens within the mentorship. But your request is based on, is for case management. Are mentors then volunteers?
We actually do not use mentors. Only Dr. Dockman's group uses mentors. We use hired full-time staff to do case management in intensive in-home and in schools.
Okay, thank you. Commissioners, other questions?
I'm curious about, and I will acknowledge some ignorance here about school funding formulas and whatnot. But this might be a question for Commissioner Kelly first, even though he's retired. I just want to understand, you highlighted increased referrals from across the board. It sounds like across grade levels and programs and across districts. When you highlighted Eudora as an example with increased referrals, are any of those school districts or school foundations providing any level of funding? Have you gone to any of them for potential funding? Help me understand what other avenues you've explored to help backfill what is an increasing need and seems to be creating a gap in capacity. Who else are you going to for that?
Sure, Commissioner. What I can tell you is that traditionally across the entire state, Douglas County is one of the few programs that offers truancy programming, and that across the state. Truancy is one of the driving reasons why young people are coming into the foster care system. And so we are really working hard here and have for many, many years to not have that be the case. And so obviously when the city and the county decided, or the county, I guess, decided to fund this years and years ago, that was in that effort to keep young people from entering foster care for that purpose. But traditionally no schools across the state, entire state, have worked to provide this kind of intervention. It's only basically after a young person comes to the attention of DCF then that they might offer some individualized attention to that family. But again, it's still one of the highest reasons why young people are coming to foster care across the state.
Yeah, I appreciate that answer, Gina, and I think that I would just encourage, as like the need goes up so exponentially, to explore. I don't want to pretend that schools themselves and districts themselves are easy avenues to explore. But for example, Eudora Schools Foundation, very active, has funded a lot of, I think jump-started a lot of programs in their school district. And so I just wonder between, school foundations and potentially other funding sources just to try and pace that increased need for funding.
Yes, I'm sorry, I can do a couple of different things to elaborate, and I should have mentioned this. We will follow up, and I think it's a great idea to see what other funding sources are out there. I think you probably all know this, but we work really hard to supplement our entire budget with fundraising efforts and ongoing fundraising efforts that help offset all of our programming costs, including all of our prevention efforts. But I also wanted to mention that we just have started a program, and we'll see how many of the families that we can serve, that we would have served in truancy, we can serve in our new funded program by the state. But we're just now getting some funding for a new programming aimed at generational poverty. And so it's possible that we'll be able to serve, and we will, where we can, serve some of these families who would fall in this population through that funding source. So I think we'll be able to offset at least some portion of that rising caseload, but we just don't know what that'll look like yet.
In terms of school districts, and of course, Lawrence School District has the largest number of kids in Douglas County, but we have a lot of school districts. What kind of outreach, especially I'm thinking of our rural school districts that are actually located in other counties, but Douglas County students attend there. How do you get the message out to them that this is a program that if we fund it, it's available to all students regardless of where they go to school?
So I know, Pam can.
We've done some tabling at middle schools and high schools to get the word out. We've met with teachers and teacher groups. Last year, we went with the administrative team at district just to explain how it works. Typically, the district attorney calls a meeting in the fall with all the districts, and we go over the truancy rules and laws and talk about the two programs and how to make referrals and who to contact. And we invite all the school districts in the county to attend that.
So by all the school districts, is that understood to mean 4, or is that understood to mean 9? Because we have 9 school districts that serve some portion of Douglas County. I'm just curious, who gets to be at the table? Now, the 9th one only has 160 acres, and they may not even have a student, but just making sure that we're covering all the bases.
Well, I know that I'm not familiar with it exactly, but I know it's Lecompton, Eudora, Baldwin, and Lawrence. I don't know. I said Eudora, I thought. I thought I did.
So Santa Fe Trails.
Yeah, we do our best
yeah,
to do
we do.
outreach, but it's generally, it's hard sometimes for districts to work with two counties. But if we have a child that's referred, we work with them.
And that's why I'm looking like, what's the referral? Is it only from the schools? In which case, is it getting the schools to know, like, these 7 students that you have in Douglas County are available for this program, which might be that we don't even have a need within that, but they need to know.
If we receive notification from a school that's a youth is pre-truant, we're going to send a letter to the family with a brochure explaining our services, and then they can reach out. And we'll be following up with a phone call with them to say, here's what we can offer to you. Some families want to take advantage of that. Some are not interested at all. But we do reach out multiple times. And then if we have a youth that's kind of if they're already being served by O'Connell, we're going to encourage the family to continue to receive services for the younger youth with O'Connell, because it's easier, obviously, for a family to talk to one organization versus 2.
I just put it on your radar, for
Sure.
Wellsville,
Appreciate that.
Okay, thank you. Other questions specific to that request? Okay, who wants the next one?
So how about Douglas County Senior Resource Center? Megan, thanks for being here. There's some dire stuff in your report about use of fund balances to cover costs, and wasn't a really great projection looking forward either. I'm interested in which, if you became a county agency, because you're asking for COLA, you're at 58% of your budget comes from Douglas County. What grants could you not, what would be the financial revenue liabilities that might be in place if you were to become a county agency and we could wrap you into many of the 401ks, and that's a long conversation that we're not going to do, not 401k, but capers and all that jazz. Yeah, sorry. But all the other things, because that's something that you, like, what would be the liabilities there?
Since you brought this up last year, I've done a lot of thinking about it and have done some background conversations with kind of just anybody that I could think of that might have some feedback on that. One of the biggest elements, as I understand it, is that the senior resource staff currently are not paid at a level as other county staff are paid, and that would be a significant shift in the budget just to bring those staff up to parity of the county employees. That I don't know how you figure that dollar amount, because I've never been part of the county budget conversation for county employees. Otherwise, I think that there would be some challenge in our fundraising that we do. We have been increasing our direct fundraising. It's going, it increases each year. We just did an appeal in the last couple of weeks. It's going really well, but it's just it's not keeping pace. And so my expectation is that the majority of our donors are older adults who receive our services. And just going off of my impression from conversations is that older adults are often very vocal about their property taxes. and that I would have a very hard time convincing them that there is additional fundraising that they would feel inspired to make to the Senior Resource Center. So I think that we would potentially lose some of our funding in that department. As far as grants are concerned, I'm not sure that we would lose any grants. The KDOT and KDAD's grants that we receive, they fund other county organizations across the state. We don't get a lot from either one of those, but I don't think that would be a loss. Other grants that we receive are not necessarily ones that, as far as I'm aware, are restricted to private 501c3s. Those dollars are also not huge. And they're really most of them are targeted towards senior wheels and supporting the expenses of senior wheels. So that's definitely a conversation that I think that we could potentially maintain.
And I believe it's on our schedule to have some broader discussions about seniors and senior services in the fall. So I'm really looking forward to that. And I think maybe that's a part of the discussion that we'll have too, but just trying to make the best use of our resources for that population.
Yeah, and we've got Senior Resource Center is a really active participant in the Housing Stabilization Collaborative that Gabby leads. And then they've also joined our A Place for Everyone supportive housing work groups as well, just to make sure that we're thinking comprehensively as it relates to seniors.
Any other questions at the moment for Senior Resource Center? Okay. And Jill, maybe this starts with you, the family shelter project. So that is a proposed partnership with the city of Lawrence. So anything that we would do would be contingent upon them funding their portion of it, so we would have the capital funds and then they would have the continuing operations. Is that the case?
Yes, they are committed to the funding to remodel the building to have it to suit the needs of a family shelter, and then building upon the funding agreement that they have, looking at a funding model similar to what they have with the Lawrence Community Shelter. That doesn't mean Lawrence Community Shelter would be the operator, but they would be letting a RFP, so to speak, that the county would be, I think we'd be a partner in developing that RFP, but they are committed to being the primary funder or leading the funding conversations for the operations of that. But I would also just say that there's still a lot of questions about what the operating budget would look like for that. And I think that's a longer future discussion, but acquiring the asset is step one, and that's where we're at.
I think some of it would be dependent upon the sales tax.
That's correct. But I'd also say that, I think we're going to be having a discussion. The Lawrence Community Shelter is going to be having a special board meeting that will be publicly available to others about progress to date with the new governance model over the last 6 months, but also looking ahead for the next 6 months and into the future, and how do they sustain the footprint of services that they have right now. So again, whether they're the operator of this family shelter or not, the city of Lawrence's investment in this space is significant at this point. So I think there's just going to be a lot of discussions about what does the operating model look like, and who could the potential partners be that may be doing this work today, but may not be. And how do we think maybe a little differently?
So in terms of the timing for our budget, the request is to build that in, but it's the contingent upon these, you mentioned even the city sales tax conversation. And when is that supposed to happen?
My understanding is it'd be November, of 2025.
Okay.
A location has been identified in the city limits, though. And so right now, we have there is an opportunity, and the city would be leading the discussions to purchase and acquire that. So these funds would go to the city of Lawrence, and they would take it from there in terms of acquiring the building and moving forward on the necessary improvements. So I think just to get it to where it's able to operate, so to speak, is probably like 2 years away from now. So there's a process in front of us to this, but this would be step one. And it is an important goal in our strategic plan.
Any questions on that, commissioners? The housing, the voucher project, that's also kind of a placeholder for the larger program being built out. Is that correct? In 2025?
Yeah, I think there's some additional information that commissioners would need to, I think we could identify questions that you all have, if we've got time later on in these hearings, if you've got other things to make sure that we can help prepare a more fully fleshed out discussion.
Thank you. Commissioners, what other questions do you have?
And we can do some of those now if you've got questions now for July. I just want to make sure that if we get to all our community partners.
Yeah. I see Eric is online with Douglas County CASA.
Yep.
Yeah. And Eric, I want to be as blunt as possible here. In past years, we look carefully at funding that is being asked of our Douglas County community, and then look at fund balances for certain agencies. Douglas County CASA currently has a fund balance of 220 of its total assets, and you're asking for $60,000. So I need to understand why we need to put that tax burden on our taxpayers when you guys have 220% of your total operating budget in reserves.
Sure, that is Eric. Can you hear me?
Yeah.
Yeah. So we have historically had our endowment established in order to work toward, being able to invest back into our organization using those funds. And annually for the past 3 years, we've been reinvesting, it'd be 3 to 5% of the proceeds from those investments, looking at a 3-year average, back into the organization. And the board has done that for 3 years, and we've invested that in development and fundraising work. And we've doubled our budget over the past 3 or 4 years to do that. So that's how we've been using those funds. And if we continue to spend down principal, we wouldn't have an endowment to fall back upon. And then I guess the second component of that would be, historically, the county has, we had property, or we had, I guess, an office in the courthouse that we shared. And so we got this grant, from what I understand, originally to help support getting a new building and being able to operate and continue to serve kids who are under the protection of the county in the judicial district. And so we continue to use the funds to do that. And now we now have been blessed with a gift from Mr. William Dan being named in his estate, which is how we have such a large fund balance now. And we used $575,000 of that fund to purchase the building, and secured other grant funding to help renovate our current facility. So now we're set and prepared to grow. So, it's a board. The board decides how to use those funds, and just historically, and moving forward, that we're following that investment policy, which is to continue to keep those funds on hand for when we need them for other things. And we've historically just continued to ask for the support from the county to continue serving the kids and doing the daily operation work that is necessary. So,
thank you.
Yeah.
We might need to invite some new partners up. Do we have any other questions for those we have at the table? Okay. I wouldn't mind. Thank you very much for being here. Visiting nurses, JAAA, Trinity In-Home Care.
Trinity is online, and Susan, you need to accept my promotion to panelist.
Come on up. Commissioners, anybody else you want at the table for this next round? Okay.
No. Yep.
Do we have our Trinity person in? Okay, hi. My main concern really is that I need to see a new budget. The numbers are not consistent. They're not internally consistent. So I don't have a good way to make sense of it in terms of fund balance. 2024 adopted fund balance ending was 10,000, and then it's 100,000 revised. So just I think maybe some of your 2024 current estimates might have been year-to-date numbers, but it's really hard for me to tell. If that's something you can get to us, that would be really super. I don't have any other questions.
I just want you to know that staff asked partners to update their budget sheets, and sometimes they get updated and sometimes they don't.
And just for partners overall, financial health and how you show us your financial health matters a lot to what I am comfortable funding with taxpayer dollars.
She's gonna need some.
Visiting nurses. Here. How about introducing yourselves first? Yeah.
I'm Cynthia Lewis. I'm the CEO of Douglas County Visiting Nurses.
I am Pam Morgan. I'm the Director of Finance at the Visiting Nurses.
Thank you. Thank you for being here. Kind of a similar question to Commissioner Kelly's earlier. There's a large fund balance relative to the expenditures for the year. What's kind of the overall goal for that money? Is there a large project being planned that's being saved up for, or what can you tell me about that?
We actually, our finance committee of the board is discussing transferring some of those funds into an endowment that would help support our overages on charity care. If you noticed in our request, our charity care has increased year over year, and 40% in the last 3 years. With the changes in reimbursement from Medicare, you will also notice that fund balance, even though still more than 1 year's of operating expenses, decreased by $1 million from 23 to 24 current estimates, and is projected to decrease another almost 1.2 million from 2024 current estimates to 2025. So if we continued at that pace, and much of that is related to, of course, some of it is related to the financial markets, how those accounts are performing, but also because of the losses, the operating losses that we're incurring. So if we continued along that trend, we would essentially not have a fund balance in, what did you project, Pam, about 10 years?
Maybe a little bit less, but about 10 years.
Yeah.
Medicare funding for home health continues to decrease. So having an operating profit is almost impossible with rising inflation. So we anticipate needing to use a fair amount of that fund balance just to exist over the next few years while we work on what other things we can do to fix that.
What is the value? So you're in the Douglas County Health Building.
Mm-hmm.
Do we track kind of the value of the not paying rent in that facility? So that might be a Sarah question. So
We don't.
okay.
We do. The value of the building is approximately $315,000. We have to show that as income and expense on our profit and loss statement. And we periodically, about every 2 to 3 years, get with a real estate expert and get a new estimate on that. So the value of that building is about $315,000. You're very welcome.
Commissioners, do you have any other questions here? All right, thank you. Any other partners that we need to have up for questions? Or I need to look at it. I think those are all the questions that I have for this round. Commissioners, are we?
Jill, can you talk a little bit more about the local voucher project? We didn't really talk about that, and I know we have some time here.
Sure. Well, the idea for this proposal was, it stems from the Corporation for Supportive Housing did a needs assessment for Douglas County in 2022. And one of the recommendations in that document to meet the need for the 300 or so supportive housing units that were identified as needed in the community. And disclaimer on that, a good number of that number is, of that 300 or so, is the IDD population, which significant need there, absolutely. At this point, that the priority population that we've identified in a place for everyone, we were more looking at chronically homeless, justice involved, and chronically homeless, including families. Those were the populations that we were most had identified for that needs assessment. But we also, all the populations that were identified in that 300 number are significant and important. And so I just want to just disclaim that. But to meet the need, one of the recommendations that were made, there were a few of them that were made, but the one that was the most realistic was to develop basically what's proposed to you all, a flexible housing pool. And that is reflective of, while we are working to bring more units online, we talked about some of those projects earlier today. Those projects that we've talked about and that are already in the pipeline, we talked about a couple months ago through Tenants to Homeowners and Burt Nash. While those projects are in the pipeline and we anticipate future new capital assets coming online to meet our goals, the need to provide supportive housing to folks in this community is significant today. The number of folks that are sitting on the coordinated entry list each week is significant. And one of the primary reasons why folks stay on that list such a long time is because we do not have a funding source to pay the rent and the rent, utilities, and most importantly, the supportive wraparound services that are needed to keep folks housed. When there are funding sources available, significantly during the pandemic, the Lawrence Douglas County Housing Authority got a whole new infusion of emergency housing vouchers. Those moved very quickly. Those are used, and that's the model that this is looking at. It's taking folks that are on that coordinated entry list based on their vulnerability and identifying them to be, as soon as possible, rehoused and have supportive services assigned to them through a community partner agency. So this funding takes away all the strings that the U.S. Department of Housing and Urban Development commonly has with it, that makes it a lot harder to quickly move folks and identify them. These local funds would be administered in a similar way, potentially with a partner like the Lawrence Douglas County Housing Authority that has really strong relationships with local landlords, has the administrative capacity to do this kind of work, and is a part of their day-to-day business. This has been discussed with them as an idea, and there's a lot of interest there. It's something that they do well. But the Corporation for Supportive Housing identified the model of a flexible housing subsidy pool as a model that's worked in several other communities around the country to help solve this challenge. So when we knew that there was dollars available through the behavioral health sales tax, this seemed like a prime opportunity to operationalize this model. And as I outlined in the request, the upfront development of an administration of design and development of this program would be substantial on the admin department, but I think based on the work that Gabby and I have been doing historically and the work that we've been doing with our different partners, most notably the Lawrence Douglas County Housing Authority, Tenants to Homeowners, I think we have a lot of wind in our sails, so to speak, and how we develop this moving forward. But we have a lot more work to do. And we would, of course, bring that back to you as the work develops in the coming months if we were able to get your support.
Is the intention that these be pretty much strictly housing vouchers for rent, or are there, do we have the service providers that have the capacity to take these folks on, and is it paying for part of that?
It would pay for both. It would have to pay for both. So the funding would go to the rental subsidy, the resources to secure the units, and that would be needed to, pay, the property management if need be, damage deposits, and again, the rental subsidy, but then separate memorandums of understanding and agreements would be in place with the supportive service providers, and keeping those things very separate. The property management, the rental management, keeping those things separate, which again, that is a model that the Lawrence Douglas County Housing Authority, their transitional housing program has, I think, an over 90% success rate because they pair themselves with trusted community providers like Family Promise, Burt Nash, and others that I'm leaving off my list. But, and the work that we've done in the last year with the Corporation for Supportive Housing, we did two-day, 4-day total intensive supportive housing training to develop this shared model of what is our commitment to as a network of an ecosystem of supportive housing providers. What is our commitment to what this supportive housing framework is going to look like, whether it's property management or the supportive services? How are we going to do all that together? And Gabby's been doing a ton of work along with Angie Bauer with Tenants to Homeowners to operationalize the development of an eviction prevention framework that will underlie all that and play a significant role in the success of this flexible housing pool moving forward.
Is it anticipated that these would be private landowners that, landlords that we have build these relationships with, or are those units likely to come from community partners?
It could be both. It could be Tenants to Homeowners has a significant capital footprint, but it could be private landlords as well. We know that Burt Nash supportive housing team has had a lot of success with some private landlords as of late, even to the point where they're able to have supportive office space set up in some of their shared group spaces. We're hitting a lot of strides right now, so it's going to have to be a mix of both to be able to support the volume of folks that we know we need to be served. But I think, the capital assets that are already available through some of our community partners, I think will be one of the primary ways that we partner, because we know that our chances of having fair market rent are a little better there. But I think this will be a meaningful tool with the private market as well.
Other questions for Jill? No. Okay. Is that a no? I think we will take a break until 11 o'clock. We will get back on schedule for the Health and Human Services conversation. So thank you, everyone.